What if I told you that the reason your legs feel weaker after 60 has less to do with your age and more to do with what you are not eating every single day? Most adults over 60 are told to just walk more, stay active, and accept some muscle loss as normal. But a 2023 study published in the American Journal of Clinical Nutrition, led by researchers at Tufts University, followed over 1,200 adults between the ages of 60 and 85 for 3 years and found something startling. Seniors who consumed one specific nutrient-dense food daily improved lower body strength by 18%, increased walking speed by 12%, and reduced fall risk by 22% compared to those who did not, without increasing their total exercise time. That is not a small difference. That is the difference between climbing stairs confidently at 75 or gripping the railing in fear at 70. The truth is this: after 60, your muscles do not simply shrink because of time. They shrink because of something called anabolic resistance. Your body becomes less responsive to protein and less efficient at stimulating muscle protein synthesis. Unless you strategically trigger the right biological pathways, you lose strength year after year, even if you are trying. But when you activate those pathways properly, muscle tissue responds, nerves refire, blood vessels expand, mitochondria regenerate. And it starts with what you eat daily. As a surgeon, I have seen this pattern repeatedly in clinical practice. Patients who prioritize one specific daily food source show measurable improvements in leg strength testing, sit-to-stand times, and post-operative recovery rates. Lab markers improve. Inflammatory markers decrease. Insulin sensitivity improves. Muscle fiber recruitment becomes more efficient. This is not theory. This is measurable physiology. And number one on this list, the one I am going to reveal last, has been shown in a 2022 European clinical trial to increase lower limb muscle cross-sectional area by nearly 9% in adults over 70 in just 16 weeks when consumed consistently. But before we get there, you need to understand the full picture. Because after 60, you are standing at a crossroads. One path leads to strong legs at 80, walking independently, traveling, lifting your grandchildren, maintaining balance, protecting your brain. The other path leads to gradual weakness, slower reaction time, increased fall risk, dependence on others by 70, and a silent loss of confidence. Leg strength is not cosmetic. It is survival. It is circulation. It is brain health. It is longevity. Now, before we continue, tell me your age in the comments. Tell me where you're watching from. And tell me the biggest challenge you're facing with your legs right now. Is it stiffness, weakness, balance, circulation? I read these comments carefully, and I reply to as many as I can. Now let's get into the 5 daily foods that can dramatically strengthen your legs after 60. Number 5. Eggs. This may look simple. Most seniors think eggs are just protein, but they are far more than that. A 2021 study from the University of Illinois followed 100 adults over 65 who consumed 2 whole eggs daily for 12 weeks. Compared to a control group, they increased leg press strength by 14% and improved sit-to-stand performance by 11%. What made the difference was not just total protein, but leucine concentration. Leucine is the amino acid that activates mTOR, the primary switch that turns on muscle protein synthesis. After 60, your leucine threshold increases. You need more to trigger the same response. 2 whole eggs provide roughly 1.1 grams of leucine, enough to stimulate that threshold when paired with other protein sources. Here's how to use them strategically. In the morning, scramble 2 whole eggs over medium heat. Avoid high temperatures to preserve nutrient density. Eat them within 30 minutes of waking if possible, when cortisol levels are naturally higher and muscle tissue is more responsive. Pair with a source of vitamin C like berries to enhance collagen formation. Consume slowly, chew thoroughly, and focus on nasal breathing while eating to stimulate parasympathetic digestion. Do this 5 to 6 days per week. Why does this matter for your legs? Because the quadriceps and gluteal muscles are among the largest muscle groups in your body. When you stimulate muscle protein synthesis early in the day, you reduce sarcopenia progression. You preserve type 2 fast-twitch fibers responsible for reaction time. You support neuromuscular signaling. Over time, this improves fall prevention, insulin regulation, and even cognitive function through improved metabolic efficiency. If number 5 surprised you and you're realizing how powerful simple daily nutrition can be for your legs after 60, take a moment right now and press the like button. When you like this video, it tells YouTube to share evidence-based senior health guidance with more adults who need it, and it helps us continue bringing you practical, research-backed strategies to stay strong and independent at any age. Number 4. Greek yogurt. Most seniors overlook fermented dairy, but a 2022 randomized controlled trial from McMaster University followed 150 adults over 65. Those who consumed 20 grams of high-protein Greek yogurt daily increased lower body lean mass by 8% over 16 weeks. The key mechanism? Casein protein. Casein digests slowly, providing sustained amino acid delivery. That reduces overnight muscle breakdown and enhances recovery. Here's the step-by-step approach. Choose plain, full-fat Greek yogurt. Measure 3/4 cup. Consume in the evening, ideally 1 to 2 hours before bed. Add a tablespoon of ground flaxseed to provide omega-3 fatty acids and fiber. Stir thoroughly. Eat slowly. Avoid added sugars. Frequency should be at least 5 nights per week. After 4 weeks, increase portion slightly if tolerated. Why does this support leg strength? Overnight muscle breakdown accelerates after 60. By delivering sustained amino acids during sleep, you preserve muscle fibers. You enhance capillary growth. You support nitric oxide production through improved endothelial function. Long-term, this supports bone density and reduces hip fracture risk. Number 3. Spinach. Most seniors think of spinach as iron, but it is a nitric oxide powerhouse. A 2020 study published in Hypertension, conducted by researchers at King's College London, showed that daily nitrate-rich vegetable consumption improved arterial stiffness by 9% in adults over 60 within 8 weeks. Improved arterial elasticity means improved blood flow to your legs. Here's how to use it. Take 1 cup of fresh spinach daily. Lightly steam for 2 minutes. Do not overcook. Add a teaspoon of olive oil to enhance fat-soluble vitamin absorption. Consume at lunch. Breathe deeply before and after eating to stimulate vagal tone. Nitric oxide expands blood vessels. That improves the muscle pump in your calves. Better circulation means better nutrient delivery, faster recovery, stronger contraction. And here is what most people over 60 do not realize. Reduced blood flow is one of the earliest contributors to leg fatigue and balance instability. When nitric oxide production declines with age, capillary density decreases and muscles receive less oxygen during even simple movements like standing or climbing stairs. By increasing dietary nitrates consistently, you enhance endothelial function, support mitochondrial efficiency inside muscle cells, and improve proprioception through better oxygen delivery. Over time, this translates into steadier steps, faster reaction time, and reduced fall risk. If number 3 opened your eyes to how circulation directly affects leg strength after 60, share this video with a friend, spouse, or family member who struggles with weak legs, balance issues, or poor blood flow. One simple share could help someone you care about reduce their fall risk, improve stability, and regain confidence in their steps. Strength is more powerful when it's shared. Number 2. Salmon. Omega-3 fatty acids are not just for heart health. A 2022 trial from the University of East Anglia followed 200 adults over 65 who consumed fatty fish 3 times per week. After 6 months, they experienced a 16% increase in muscle strength compared to 7% in the control group. Omega-3 improve insulin sensitivity, reduce inflammation, and enhance mitochondrial efficiency inside muscle cells. Eat 4 to 6 ounces of wild-caught salmon 3 times weekly. Bake at 350 degrees for 12 to 15 minutes. Avoid deep frying. Pair with leafy greens. Chew thoroughly. Exhale slowly between bites. Over time, omega-3 incorporation into muscle membranes enhances contraction efficiency and reduces inflammatory cytokines that degrade tissue. But the deeper mechanism is even more powerful. Omega-3 fatty acids, particularly EPA and DHA, integrate directly into the phospholipid bilayer of muscle cells, improving membrane fluidity. This enhances anabolic signaling through the MBH2I pathway and increases muscle protein synthesis response to dietary protein. In adults over 60, chronic low-grade inflammation, often called inflammaging, accelerates muscle breakdown. Omega-3s blunt this inflammatory cascade by reducing interleukin-6 and tumor necrosis factor alpha levels. Improved insulin sensitivity also means more efficient glucose delivery to working leg muscles, which directly supports endurance and recovery. Over months, this translates into stronger contractions, improved balance control, better joint stability, and measurable reductions in frailty risk. If number 2 helped you understand how inflammation and muscle loss are connected after 60, make sure you subscribe to Senior Health Support right now. Every week, we break down research-backed strategies specifically for adults over 60, so you can strengthen your legs, protect your independence, and age with confidence using science, not guesswork. Number 1. Whey protein isolate. This is the most powerful. A 2022 clinical trial from Maastricht University in the Netherlands followed 180 adults over 70. Participants who consumed 30 grams of high-quality whey protein daily increased lower limb muscle mass by 9% and improved walking speed by 18% in just 16 weeks. Whey protein isolate. This is not marketing hype. It is biology. Whey is rapidly absorbed. It delivers a high leucine concentration, about 2.7 grams per 30 grams of protein, enough to overcome anabolic resistance. But here is the key. Timing matters. Consume 30 grams of whey within 60 minutes after physical activity, even if that activity is just a brisk 15-minute walk. Mix with water or unsweetened almond milk. Shake for 20 seconds. Drink slowly over 5 minutes, Inhale through the nose. Exhale slowly through the mouth to maintain parasympathetic tone. Start with 5 days per week. After 4 weeks, evaluate strength improvements by testing sit-to-stand repetitions in 30 seconds. Progress to daily intake if tolerated. Why is this transformational? Because whey activates mTOR aggressively. It stimulates satellite cells responsible for muscle repair. It enhances insulin-mediated amino acid uptake. It reduces muscle protein breakdown. I have seen patients in their mid-70s improve stair climbing speed within 2 months. One 78-year-old patient increased his leg press strength by nearly 20% after adding consistent whey supplementation combined with moderate walking. Long-term, this improves reaction time, protects against frailty, reduces mortality risk, and supports brain health by improving glucose regulation and cerebral blood flow. This is not about bodybuilding. It is about independence. It is about standing up without using your hands. It is about walking confidently at 85. When you compare the time investment, less than 5 minutes per day, to the measurable strength gains, the efficiency is undeniable. Most advice tells you to exercise more. But without the proper nutritional trigger, exercise alone cannot fully reverse muscle decline after 60. And here is the truth. It is never too late. Research from the University of Alabama at Birmingham in 2021 demonstrated adults in their 80s increased muscle mass by 6% in 12 weeks with targeted protein intake and resistance stimulus. Neuroplasticity continues. Muscle fibers respond, capillaries grow, mitochondria regenerate. Your body is adaptable, even now. So tell me in the comments, which of these 5 will you start today? How old are you? And what activity do you want stronger legs for? Travel, hiking, playing with grandchildren? Commit to one change today. Now, if you truly want to maximize what we discussed today, understand this. Food is the foundation, but micronutrients are the hidden amplifiers. You can eat the right proteins, support nitric oxide, and improve muscle activation. But if your body is deficient in key vitamins, your legs will still cramp at night, fatigue too quickly, or fail to recover properly. Many adults over 60 are unknowingly low in specific nutrients that directly affect nerve signaling, muscle contraction, and electrolyte balance. That's exactly why I created the next video on this channel. Top 7 vitamins to strengthen your legs, prevent leg cramps in seniors. In that video, I break down which vitamins directly influence calcium regulation, neuromuscular firing, mitochondrial energy production, and circulation, and which common deficiencies silently increase your risk of weakness and nighttime cramps. One of them, in particular, has been shown to reduce muscle cramp frequency by over 40% in older adults when corrected properly. If you want stronger, steadier legs, not just today, but for the next decade, watch that video next. Click on it now, and let's continue building strength the right way.